Hello, I'm Marcia Jones. Thank you for your interest in the hormones of cancer for nurse practitioners. I think this is such a huge topic. And if you are familiar with me, I've been doing quite a bit of posting about hormones, hormone related cancers, and trying to educate other nurse practitioners about this topic because it's our future. It is where we're going to be guided with the patients that we're taking care of. And so I am Marcia Jones. As I said, if you followed me any, you'll see that I've been really kind of pushing this topic lately. I am a nurse practitioner, obviously. I have been in the field of healthcare for over 20 years. I myself have done a lot with hormone management. I've been doing hormone replacement therapy on myself for over 10 years. And as we have progressed, like always, things change. And the clientele we see changes, our patient population changes, our demographics change, and our focus of care changes. And so this is some new territory. And I know that I myself wasn't totally familiar with hormones in the beginning, and I had to do a lot of research on my own. Even after I become certified in hormone therapy replacement, I was kind of trained originally just in bioidentical hormones. So they left out a lot of the pieces, I believe, in this because it was very focused towards their model and what they were wanting us to learn. But as usual, once you learn a skill, you need to grow and adapt, and you need to build that skill and learn more about it. And so I have taken on hormones because, first of all, I myself was in a miserable place when I started hormones, and I have been a new person since. And so what I've learned for myself and for, with my patient population over the years has helped me to develop a course and to develop this information that I want to bring to you about hormone related cancers. Because, like I said, there's so much. People come to us because they don't feel well, but what we know is that the imbalance of hormones is increasing their risk for hormone related cancers right now because breast cancer is the number one cause of cancer in the United States for women. And hormone related cancers in general are going to be the number one cause of death in the United States. It's superseding cardiovascular disease. So, like I said, a lot of us have not been trained well in hormones, or we try to push that off to a gynecologist or an endocrinologist, or there's with so much uncertainty and lack of education, it's difficult to sometimes manage these things. And the management that I do is from a functional perspective because I'm a functional medicine provider. And so I'm trying to empower women to live that life of vitality, but at the same time, reducing their risk of hormone related cancers. And this, yes, is focused primarily on women. There'll be some information in here that you'll be able to take for your male clients as well. But this is primarily a female focused hormone related webinar that we're presenting. So hormones in general, let's start with this. If you've ever been afraid of hormones, don't be. There's lots and lots to learn, but it's very doable, and I think that it will make a huge difference in your practice because you will be able to identify hormone imbalances that you didn't think of, and you're going to be able to make a huge difference in the lives of your patients and maybe even yourself. So the hormones, they're a dance, This is why this woman is here. It's a dance. It's perfect balance. So like it or not, hormones are here. We need to focus on them and specifically in women. Because, as I'd said, hormone related cancers are the number one cause of cancer, and the cases are climbing very rapidly, and they're being diagnosed at younger and younger ages. And so, the more that you learn about hormones and the more prepared you are to identify and balance these hormones out at younger ages, the more protection you're going to provide to our female population. So, breast cancer, as I said, number one hormone related cancer, and estrogen is the link to hormone related cancers. And it is the most misunderstood hormone. And so, most people are like, nope, I don't want anything to do with it. It's going to increase our risk of cancer. I don't know a lot about it. Just they leave it alone. But estrogen's not quite as scary as what you think. But how comfortable are you with identifying and managing hormones in your practice? So just think about that for a couple minutes. Hormones themselves, and then we're going to get into this hormone related cancers. So, cancer, this is my definition of cancer. Cancer is a lifelong, genetically predisposed metabolic disease of the mitochondria that requires a lot of energy, resulting from an immune system that has been broken by toxic exposures, lack of nutrition, fueled by inflammation, and is rapidly on the rise, targeting estrogen dependent reproductive organs, and is the number one cause of death in the United States. That's a lot. But that there is the complete definition of cancer and why it is important for you to be aware and in tune. Because think about what metabolic diseases are. Think about the mitochondria. Think about genetics. When you think about your practice and just those words alone, then you understand the importance and how just learning hormones can help you to manage multiple things, not just cancer. 1 in 3 women will develop cancer in their lifetime. And there is no cure for cancer. So, along that line of the definition I presented, there's no cure for cancer. Only 18% of cancer survivors will live 20 years after the treatment. 69% of those will live an additional 5 years. These survivors are our patients. So, again, how comfortable are you with managing cancer in your clinic? Because these are our patients. These are the people that we'll be seeing. The oncology departments are not going to be able to handle the influx of patients that we're seeing. And we're the front line. As always, we're the ones who have to adapt and change and be ready for whatever crisis may come our way. So, how prepared are you to manage cancer survivors? What do you know about it? If it's not curable, if there's always going to be a chance of recurrence from that remission, how prepared are you for that? This is a whole new era in healthcare for us and with new threats to health. So, we need to shift our mindset and shift our approach and be ready. We need to educate ourselves in hormone focused cancer care. So, here's the current cancer care model. There's a focus on destruction. And absolutely, when there's cancer, you want to destroy. But this is our current model. They go in, they destroy. There's a little bit of a lack of cause analysis. And when I say cause analysis, we know there's cancer, and we know cancer is a mutation of dysfunctional cells. But where did that cause actually come from? What caused the breast cancer? What caused the ovarian cancer? What caused the endometrial cancer or whatever cancer we're dealing with? There's lack of nutritional guidance through cancer therapy. They go in, they destroy. And this is by no means trying to put down the current oncology system at all. There's just a lot that isn't taught and a lot there isn't time for. And we go in and we identify, we diagnose, we conquer, we destroy, we move on. This is where we come in because we're the ones who need to provide the rest of these therapies. There's a lack of emotional support. How often do our cancer patients get the amount of support that they need? The real hand holding, the assistance through the journey, because there's so many emotions that go with cancer. That everyone is different. And when it all starts, it's happening so fast. And there's decisions that have to be made, and the person is trying to process the fact that they even have cancer and what this means for them and their life and their family and everything else. And do they really get the emotional support they need, or are we just kind of going through the system? And then I believe that there's a lack of complementary therapies. Like I said, I'm trained in functional medicine, and I've been doing conventional medicine for many years prior to functional medicine. And when I discovered functional medicine, it was like the skies opened up and everything started to make sense. It was so much clearer that, I was so disappointed that we haven't been taught about these complementary therapies. They're there, they're well studied, they've been there for centuries. Why would we not know about these and be able to help offer these to our patients? Some of them you can't charge for in the current conventional system, unfortunately, so they're not really pushed to the forefront. And I think we have poor life after treatment support, as in life after cancer treatment. You ring the bell, that's very symbolic, and you move on, and you're said to be in remission or cured, or a false sense of cured. Cancer is not cured, and we need to teach and educate our patients on what most likely was the cause of the cancer to begin with, where it first stemmed from, and those be the things that guide us in helping to prevent them from having a recurrence. There again, I said that false sense of cured. People, some are either very scared or they go on about their life as if, they are cured. So there's a lot more to cancer care than there is than just chemo and radiation. And we don't know everything there is to know about cancer, but we do know a lot. about cancer. And that is my mission, is to help to train you on a lot of the things that we do know about cancer that we may not be aware of, and that if we learn and educate ourselves, we can help our patients much better in our clinical practice. So, through our definition, cancer is a genetic disease. You can change genetics. Whether you know this or not, you can change genetics. Cancer is a systemic disease. Metastasis happens because it's a systemic disease. Cancer cells can travel anywhere and they can replicate anywhere in a system that is weak. Cancer is a mitochondrial disease. I'm sure you may not have thought about this one, but supporting the mitochondria is critical. The mitochondria are the powerhouse of every cell, in case you forgot that biology lesson, and they control the replication of cells. That includes our cancer cells. So, this is how the mitochondria are a huge player in cancer. Now, cancer is a metabolic disease. So, metabolism is profoundly affected by multiple hormones, including insulin. So, a focus on supporting metabolism is critical and can be implemented into any practice. Like, we're already managing obesity, which is a metabolic disease. We're managing glucose levels, which is a metabolic disease. Now, when you look at this and you put it all together, you'll start to see why cancer is a metabolic disease. Inflammation will fuel the spread of cancer. Inflammatory conditions are stress, chronic infections, obesity, lack of sleep. All of these things play a role in inflammation. And that's like putting fuel on the fire when it comes to cancer. A healthy immune system is critical for cancer care. The immune system is supposed to, do its surveillance. It's supposed to find anything that's abnormal and damaged, destroy it, and keep it from becoming a malignancy and replicating. But if our immune system is damaged or weakened, it's going to miss these cells, and then there goes cancer taking over. So we must repair and protect the immune system. Now, cancer requires a lot of energy. This is why a lot of times we'll see weight loss in our cancer patients. It's one of our first clues. So, nutrition is very important for supporting the energy needs and to starve out the cancers. So, we need to know how to educate our patients on cancer related nutrition that provides them with energy. There's also cancer related nutrition that prevents cancer and helps with, balancing metabolism. But when you're actually during the treatment phases, you have different requirements for energy and nutritional intake. Then we have toxins that overload the body and damage the cells. Toxins are everywhere in our life. How you process and eliminate those toxins is the most important factor in cancer. So, supporting elimination and metabolism are key interventions for decreasing the toxic burden, and that is going to help our patients to be survivors and to prevent relapse and recurrence of cancer. So, this is my proposal that we take a new approach to cancer care, especially hormone related cancer care, and we try to protect, repair, prevent, conquer, and thrive when we're dealing with cancer in our patients. So, now as we're talking about hormone related cancers, we need to talk about the hormones of cancer. Some of this may surprise you, but they're hormones, they balance and maintain homeostasis and overall health. There's over 45 hormones in the body, and it requires a little bit of skill to keep them all into check and to keep them balanced. The top hormones of cancer that we're going to cover are estrogen, testosterone, progesterone, insulin, and cortisol. So, estrogen, for your review, is very important for breast development, production of the endometrial lining, maintains vaginal tissue, bone development, neurotransmitter regulation, and is cardioprotective. Estrogen imbalance happens when there's estrogen exposures and more poor metabolism um, of the estrogen that we do have. And this is how we end up with development of a hormone related or hormone associated cancers. Estrogen imbalance or dominance is actually what increases your risk for cancers in these estrogen receptor dominant type cancers that we are seeing increase. Now, review progesterone. Progesterone is produced by the ovaries and plays a role in breast and uterine activity. It has a direct relationship with estrogen, and it has a role in menstrual cycles. So you can think of progesterone and estrogen as the seesaw of balance, the scales of balance, where one is up, the other's down. If they are not perfectly balanced and in opposition of one another, trying to keep things in alignment, this is where we start to have problems. Now, testosterone, this is an androgen with many receptors throughout the body. And yes, women have testosterone, and it is important for women. The problem with testosterone is that it can be aromatized into estrogen. So, as I just said, estrogen is one of the key players in hormone related cancers, specifically breast cancer, which is our number one cause of cancer in women right now. So, the aromatization into estrogen is where the problem lies with testosterone. So the process of turning androgens into estrogens is what aromatization means, very simply put. And this can be in men or women. So men can have testosterone replacement therapy, and that testosterone can be aromatized into estrogens. This is a metabolic issue. So if metabolism is not in check, then you're going to be turning your testosterone into estrogens, and this is what increases the risk of hormone related cancers in men. So now insulin, here's a review of our insulin. It is a growth hormone. It is a metabolic hormone. It promotes tumor growth and it is pro-inflammatory. So all of those were in our definition of what cancer is. And we all know about insulin. So now cortisol, this is our other hormone of cancer. It is a stress hormone, a metabolic hormone, a reproductive hormone, has a role in immune function, and it regulates inflammation. So you see why this is in my top 5 of hormones that are related to cancer. We see the conditions of hormone imbalance every single day in our practice. Some of them are obvious, some of them are not so obvious. So I'm going to review a few of those so that you can, start to get this concept of why it's so important that we understand hormones and that we be able to understand and balance these hormones so that we can prevent cancer and give our female patients back the energy that they want, to give them back their life. And that's why I say bringing vitality back to women is my mission and my goal, because if we balance, they feel better, but we know what we're doing for them in the long run. So, signs of hormone imbalance: fatigue, mood swings, anxiety, depression, poor sleep, bloating, low libido, chronic pain, weight gain, keep going, obesity, endometriosis, PMS, irregular menstrual cycles, PCOS, PMDD. That's a lot of conditions that we see every single day, and almost every single one of our patients will check off a box of one of those conditions or symptoms. So let's talk about obesity itself. Obesity is an inflammatory condition. It's a metabolic condition associated with poor glucose metabolism and elevated insulin levels. Adipose tissue converts androgens into estrogen via aromatization. So, there I just put all of those factors into the definition of obesity for you as well. So, managing obesity is going to help manage hormones, which is going to help manage cancer. Most people want to lose weight. It's one of those primary things that they come in and ask for. Right now, we're using some injectables, the semaglutide, GLP-1s. We have a lot of tools at our disposal for managing obesity, but if you manage their hormones and you balance their hormones, you're going to balance their weight, and you're not going to need some of those things that are getting a little bit hard to come by right now, and that are a little bit controversial because obviously our semaglutides are for diabetic management, which yes is a metabolic disorder. Managing the metabolism is going to manage obesity, it's going to manage cancer and our hormones, but we can't always get it because right now it's approved primarily for diabetics and not for obesity. And some patients are using it more to just lose weight and not to balance themselves nutritionally, which has put them at an increased risk for other problems. It's a whole different topic, but that's your take on obesity and why it's a hormone related condition. Now we have irregular menstrual cycles. This itself, if a hormone cycle is not regular in a female, it is a sign of imbalance. And it results from an imbalance, usually of estrogen and progesterone. And it's a high indicator for an increased risk of hormone related cancers. Now, PCOS, we're all very familiar with PCOS. This is more and more common because of increased insulin levels, increased androgens, and there's obesity and anovulation are all related to PCOS. Again, you see how this hormone related condition can increase your risk of hormone related cancer. The top 3 areas where you can focus hormone related care: estrogen metabolism. These are your takeaways, by the way: estrogen metabolism, insulin balancing, and inflammation. So I'll go through those again: inflammation, insulin, and estrogen metabolism. If you are going to help with hormone related care and want to be hormone focused in cancer care, those are the top three takeaways. Hormone related cancers can be prevented by balancing the hormones. I think I've taken that one home quite a bit. But how confident are you with managing those hormones? So, I want to give you the confidence you need to manage the hormones. I want to give you the confidence you need to talk about nutrition and not just diet. That is my whole goal here. I want to empower you and support you in the critical role as a nurse practitioner in this fight against cancer and hormone related conditions. A functional approach to cancer. So if you've got any interest in functional medicine, even if it's just the tip of the iceberg of it, I highly recommend that you learn more about these hormone related cancers and how to prevent them from a functional approach. It addresses not just the body, but the mind and the spirit, the root cause, not just, the root cause in the whole person, not just the cancer, not just the symptoms or the diagnosis, but the whole person. It identifies what's causing any imbalance and how to correct that imbalance. So, with testing, there's a lot of things we can do to test. You have to get past looking at conventional labs in a conventional way. You just have to. You've got to be out with the old and in with the new. Everything is changing, and our education cannot keep up with the changes. And by the time this comes into mainstream, we are going to be out of control with cancers, hormone related cancers. So I really encourage you to educate yourself. Balancing hormones from a whole person approach can feel overwhelming, I know, and a little bit complicated at first, but I have faith that you can learn it. Our patients are suffering and they don't have to. They may not even be thinking about cancer, but we have to be thinking about it. That's our job. We are supposed to know and we're supposed to guide. They trust us. And what happens when you knew that a hormone imbalance could cause cancer and you didn't do anything about it? You didn't ask the questions. So, every single one of us has been impacted in some way by cancer. We have seen the fear, we felt the pain, and we've witnessed the destruction. Whether it's the person coming into us because they're afraid of the diagnosis or, having to give the diagnosis, whether it's a patient we're close to, a family member, ourselves, we've seen what it can do to a human. That is our role in healthcare, is we are supposed to help people and we're supposed to be aware of this and do something to prevent this pain, fear, and destruction. You have to prepare yourself now because this is the next wave in healthcare. You will be a hero just by making your patients feel better when you balance their hormones. But if you add hormone expert to your resume, you are going to be very highly sought after, trust me. So I do have this next level NP course, Mastering the Hormones of Cancer, to offer to you. It is 12 modules. These modules will be released weekly over 3 months. My goal is to make this into an automated system that you can do at any time. But right now, I want to put this out into these 12 modules just once a week for 3 months because it is so much to take in. There's so much information in these modules that I'm afraid that if I put it out, that you can do it all at once and just binge yourself on the information, you're going to miss some critical points. So, module one, this is the truth about cancer. This is where I cover the statistics of cancer, where we're headed, what it actually is, how it happens, what those mitochondria have to do with it, how cancer thrives, and the approach to treatment of hormone related cancers for the non oncologist provider. So, that's module one, week one. Number two, we go into the actual hormones of cancer. So we expand much deeper on estrogen, progesterone, testosterone, the other hormones that you may not suspect that are major players in the development of cancer, and the metabolism, the hormones, all that is what we will cover in that section. Then module three, the hormone related conditions that I had just touched on as well. We're going to go deeper into those and talk about each one of those and how they come to be from the estrogen, progesterone, and testosterone imbalance. Then module four is a hormone focused assessment. So, how to take an appropriate history and interview for the hormone specific conditions that you can identify that imbalance that might not always be so obvious. You have to uncover the key elements that your patient might not actually bring to your attention and that you might not think to ask or dive a little deeper into. And then module five is the hormone testing and interpretation. So this is another really big module and week in the course But this is for you to feel confident in ordering the right hormones based on your assessment and your findings, and to evaluate this imbalance in your primary care practice. You can learn how to interpret those as a whole, in addition to including some functional medicine testing if you would like, that goes beyond the traditional labs. But I can teach you how to do this in your clinic and how to manage this at any setting, insurance based or not insurance based, so that you can start to make a difference and play a role in this hormone related cancer business we're dealing with. Module 6, the basic concepts of treating hormone imbalance, part 1. This is where we're going to put that information into action. We're going to learn the foundational strategies to implement for hormonal balancing, the beginning steps of managing multiple hormones in the correct way and in the correct order, because you have to go from one to get to the next. You can't do it all at once. Understanding things like synthetic and bioidenticals and herbal hormone preparations, reviewing the controversy of hormone replacement therapy. So much in that. And then in module 7, we go beyond those basic concepts and more deeper into balancing the hormones, by more than just adding and taking away, but you have to talk about the metabolism of the hormones, how to eliminate the excess hormones, and preventing that aromatization. Then in 8, it's focused nutrition for hormones and cancer. This is where we deep dive into comprehensive functional medicine based program of nutrition. This is not just diet. This is nutrition. This is getting the nutrients you need to conquer and thrive in the face of cancer, as well as to prevent cancer and other metabolic disorders. So we're going to talk about the mitochondria, how to fuel the body while starving out the cancer, nutrition during cancer treatment as opposed to before or after cancer treatment. In module 9, we've got lifestyle factors. This is stress, poor sleep, sedentary lifestyle, all those other things that contribute to inflammation and cancer and recurrence and remission, or excuse me, not remission, recurrence. So module 10 is the environmental factors. This is where we go into xenoestrogens, how they contribute to the estrogen imbalance. We'll cover the sources of those, the DNA damage that they cause, how to repair the immune system that has been damaged by these environmental factors, and how to decrease our toxic burdens. Then module 11, we go into supplement recommendations. This is where we, talk about hormone support, detoxifying the body. Your patients are always asking for advice and they're looking for it online. You need to be in the know. You need to learn these things and have a better understanding so that you're equipped to answer the questions. You don't want them just going on Amazon and ordering things that could actually hurt them instead of improving them. So these are supplements for hormone balance, cancer prevention, and I'll also supply you with the reputable sources for those. And then last but not least, in module 12 will be integrative cancer therapies. And during this final module, we cover we cover final thoughts, miscellaneous items, integrative therapies for cancer, things like IV vitamin C treatments, infrared sauna, herbals, medicinal mushrooms. So all the things beyond. And I save this till the end because I love it. It is fascinating to me. And we're going back to the basics with the integrative cancer cares. And some patients will be receptive, others will not. You will be able to give them all perspectives, though. There is also a support community that goes along with this course for you to ask your questions, get clarification as you're going through the modules. It is a private course that is, again, directly associated with this course. So only people who are doing the course can get into that and ask those questions, and that's direct access to me. So as you're going through them, again, assisting with new concepts and implementing them into your practice, because you can learn this stuff, but once you start talking about it, you're going to have questions that come up, and I want to be here for that. So I monitor all this personally and will respond so that you are ready for success. So to be a hormone master, this course is $3,497, and it includes those 12 weeks of courses that I just talked about, supplement guides, professional account resources, access to that private community, the next level NP group, the next level NP email list, where I send out new stuff that may not be in the course to keep you up to date. And then there is a bonus lesson on how to start your own hormone clinic if that's something that you are interested in. So, to celebrate the launch of this course, the discount will be $497 until November the 13th if you use the code Hormone Master when you go in to purchase the course. To get the course and more information about that, you go to marshajonesnp.com, Master the Hormones of Cancer, and this is where you will find all the information, more about the modules, what we cover, and what it will do for you. So, also, I want to make mention that if the course is not something you're ready for right now, but you want to stay tuned, I have a new book coming out, The Hormones of Cancer. I'm so excited about it. It's going to cover these topics in layman's terms for the patient and in more concise type of format to help them and to help you, so that if they want to dig a little deeper, I've got resources for them. It will help them to have a conversation with you. It'll help them to be in the know on their own too, is what they can do for their own health. So I want to thank you for listening, and hopefully you will take advantage of this course and the opportunity to learn about the hormones of cancer for helping your patients, not just to prevent cancer, but to feel better all around. Blessings and health for you, and you take care. Again, I'm Marcia Jones, and I truly appreciate you taking the time to learn about the hormones of cancer.